Good morning, everyone. First of all, I'd just like to take a second to thank the Gerald Lee family, as well as the Beaufort Educational Trust for giving me the opportunity to present this lecture this morning. This morning, we'll be talking about angular limb deformities, or ALDs, and more specifically, the evaluation and treatment in thoroughbred foals and yearlings. My name's Matthew Coleridge, and I'm one of the surgeons here at Rossdales. So just a quick outline of what we're going to go through in the talk today. Start off with just a little bit of terminology, a couple of phrases used and colloquialisms used when describing these conditions. Then into their etiology, how they occur, and then into the guts of the talk, really, why we consider them important, how we go about diagnosing them, and then onto sort of treatment options, and then to end the presentation just to go through a few case examples. So just quickly, flexural limb deformities, which differ from angular limb and are also common enough in foals. Flexural limb deformities are in the sagittal plane, so front to back on a foal when you're looking at the side of it. And we talk about foals being contracted in those joints or lax and showing a laxity in those joints. These, like angular limb deformities, happen either acquired congenitally or at birth, and usually affect the fetlocks and knees. The acquired ones would usually develop as the foal's growing up in the first few weeks of life, and these usually affect the feet or coffin joint. So these are differing from angular limb deformities, which is what the focus of this talk is going to be about. Angular limb deformities are more in the frontal plane, so side to side when looking at the horse from the front or the back. And we talk about a Varus deformity, or I actually don't really like the word deformity. A lot of these would be not too severe or ranging in severity, and so it's almost better to refer to them as a deviation in my mind. So Varus deviation would be medial deviation of the limb, distal or below the location of the problem. So on the right-hand side of the screen, there's a picture of Varus fetlock. So you can see the pastern and the foot is deviating towards the inside of the foal, towards the medial aspect of its cannon bone. And then a valgus deformity or deviation. Here in the picture on the left is a picture of some valgus knees or carpus. A valgus deformity would be defined as a deviation of the limb, a lateral deviation of the limb distal to the location of the deformity. Varus, fetlocks, and knees would be the most common issues that we'd be dealing with in foals and yearlings. And I think we really need to keep an idea of what's normal when evaluating these animals and being hypercritical of them. I saw this video when I was trying to entertain my daughter the other morning of a Sunday morning, and I thought it was apt. I don't think I've certainly not got any good videos of foals being born and then running around after their mothers. So this video of a wildebeest calf kind of brought it home for me. I think it's great. Wildebeest actually don't let the calf nurse until they can run. So you can see in the final shots of that how the wildebeest looks. It's trying to stabilize itself on these long gangly legs, and I thought it was quite similar to a foal. And this is how foals start out in life. Everything's kind of pointing outwards, and they're doing that for a stability. And it's not because of any sort of deformity or deviation at this point. So keeping an idea of their normal development and how they start off life is very important. Moving on to the etiology, or how do these ALDs occur? There's a foal here with its mare that's showing a bit of a valgus deformity of its off knee, and then a bit of a Varus deformity of its fetlock as it's wandering around there. But these can be, like the flexural limbs, either congenital or acquired. And starting off with congenital causes, dysmature or immature cuboidal bones in the hock and the carpus are a relatively common cause of severe congenital angular limb deformities, along with periarticular laxity. In my mind, and there's no data confirming this, but in my mind, these often lead to a valgus deformity of knees and hocks, whereas Varus fetlocks tend to be, although there's a heritability aspect to them, they tend to be developed or develop over the first few weeks of life. This is a interesting couple of cases. The foal wandering around on the left-hand side of the video there was referred in for a large swelling of the right hock, as well as a lameness, but otherwise bright and well. And on X-rays, the foal had this is not the X-ray of this particular foal, but it's a similar X-ray. It's got deformed cuboidal bones of the hock, which has caused this lameness, and then also the outward deviation. And then the video, hopefully it plays here, the video of this yearling was sent to me this yearling was going to come down for evaluation, but pre-travel X-rays were recommended, and we saw a similar X-ray to that shown in the middle here. And as this yearling trots off here in the distance, you're going to see it's got a lateral deviation below the hock. I hope you can see that. So this is kind of how these things progress. They often don't present as severe as the foal on the first video, but when they get to that yearling stage, they can look a bit like this. And if you take an X-ray of those yearlings, they often have mild to more severe deformities of the cuboidal bones, and usually an associated lameness. So moving on to the heritability aspects, over the last few decades, fast horses have tended to be Varus through the fetlocks, and some work done by Morgan et al. And presented at AEP found that more horses between this 2 to 4 age group, looking at a bunch of horses, more of them were winning races with Varus fetlocks as opposed to those with straight or valgus fetlocks. Now that's not to say, and this work certainly doesn't suggest that having a Varus horse means it's a faster horse. I think it's more they just happen to have a Varus fetlock. And we know that conformational traits are heritable. Work done by Love et al. Showed considerable heritability influence or genetic influence for these conformational traits. So moving on to more acquired issues. This is an extreme example, so bear with me, but generally foals, horses, bear more weight through the inside of their leg. So this is the inside on the X-ray on the right, and then the inside on the main picture there. Most of the majority of the weight would be borne through the inside of the leg, therefore the inside of the joints and the inside of the growth plates. So it just makes sense that if you add more weight by having a heavy set animal, perhaps in a bit too good condition, you're going to add more weight through the inside of that leg, through the inside of those joints and growth plates. And as a result, that's going to act as a natural slowing down of that growth plate or a retardation of that growth plate. And as a result, the other side is going to grow a little bit faster, and it's going to cause this deviation towards the inside of the leg, or a Varus deviation. And this is a good example in this foal here. Another issue that leads to acquired deformity or deviation would be physitis. Physitis is something that I think everyone around the world struggles with in foals when it gets to, especially this time of year when there's a lot of dry, hard ground. Those foals that are tending to be quite straight already don't need much to get their growth plates inflamed, and that's what physitis is considered an inflammation of the growth plate. It's usually more mild than is depicted in the X-rays here. It usually be quite a severe physitis to get bone changes as visible on this X-ray of a knee and then the X-ray of the fetlock. But I guess it's considered a bit of a traumatic etiology to that growth plate. And what happens is that inflamed side of the growth plate closes down growth and it doesn't grow as fast. It often is on the inside part of the growth plate, and so again you tend to get that Varus deviation because of the outside growing faster. And here you can see, I've highlighted with the arrows there in that picture at the top, you can see the little bump just above the fetlock joint, and that's the prominent growth plate on that foal as a result of the physitis. This is a video of a yearling that's got a mild deviation of its knee towards the inside, a Varus deviation. And when the yearling comes back to stand up in front of us, I hope you'll be able to see there's a little bit of a point to that medial growth plate, the inside growth plate on the bottom of the radius, which is likely the cause behind the slight medial deviation of that leg. So why is this important? Well, I think everything comes back to trying to provide a protective athletic conformation for the animals so that they can go on to maximize their athletic ability with as much protection through those legs as possible. We ask a lot of racehorses, and having them in a good conformation is certainly protective. We know that carpal and fetlock injuries are highly common in horses and account for most of, when they have injuries to those areas, that accounts for the most amount of time out of training in racehorses. And so starting off with a good carpal and fetlock conformation can only be helpful. Matt Coleridge is quoted in his arthroscopy book as saying carpal injuries are a major limiting factor in training of racehorses. And I think, in my mind, getting the knees right starts with getting the fetlocks right when they're babies, and one thing protects the other thing, which hopefully then protects them in their athletic career. This would not be an uncommon occurrence. This is an adult, it's a two-year-old filly that's presented with a slight lameness and a fusion of the joint. It's got a distal radial knee chip that you can see in the x-ray on the left, and is then having arthroscopy to remove said chip in the video on the right. So there's not an awful lot of science behind all of this, but there is a bit of work done. I think behind all conformation, the basis behind all conformational evaluation is what people believe will make a good racehorse and make them protected to stand up to training at a high level. This paper by Anderson et al. Showed that offset knees in a group of horses contributed to those horses having more fetlock problems. And then another paper by Weller et al. Showing that valgus deformation was actually demonstrated to be increasing the horse's risk of injury. So again, not huge numbers and not huge amounts of literature, but there is some basis in the science. And it all comes down to the sales, really. So when a horse goes through the sales, as everyone knows, that there's a rigorous process evaluating those animals, starting with the vetting, which involves evaluation of the horse's joints, evaluation of the horse's airway, evaluation of the horse's body, and of course evaluation of the horse's conformation, with a view to getting a protective conformation that's then going to stand up to training well and help the horse in its athletic career. And obviously these horses can then sell for awful lots of money when they're hitting all the good numbers and all of these things. This is justified selling as a yearling at the Keeneland yearling sale. So moving on to the diagnosis, or how I go about, or what I think is important when diagnosing these animals. First of all, the first question I always ask someone when I'm looking at a foal is how old is the foal? I think you need to know what age and stage that foal is at relative to its most predictable areas of growth. And so starting off with a static evaluation of the foal, and then moving quite quickly on to a dynamic evaluation, which I think is very important. This foal in the video that's just played is a 6-week-old foal. It's got a decent conformation. It's slightly straight through its fetlocks, but at 6 weeks old, it's something that we need to monitor, perhaps do something with its feet, but not a candidate for anything more serious just yet. I think it's also important to look at the mare. This is another video of a foal with this is an 8-week-old foal with a more severe Varus deviation of both its front fetlocks. Hopefully you can see as they walk towards you, and keep an eye on the mare as well if you can get a look at her. She's got a very similar conformation to her foal. And so I think that you can beginning to see the heritability aspect coming into the evaluation stage of these animals. This foal's walking towards you there, and I think it's decently obvious from the zoom in that there's a bit of a Varus deviation of those fetlocks, and hopefully you can see in the side that the mare's got a pretty similar looking conformation. And I think radiographs sometimes are necessary with severe deviations, deformities, and also to evaluate the state of the growth plate. There's no point in trying to affect something where the growth plate's already closed. And as we touched on, looking at the cuboidal bones in those very young foals can be important as well. Sorry. And part of the static evaluation, often these foals, as we kind of mentioned when looking at the wildebeest, they'll start off with everything pointed outwards. So looking at that foal in the picture on the left-hand side, you can see looking straight at him that he looks like he's got quite a turned out fetlock on the right forelimb. But when you actually take a step to the side and line up that cannon bone, so you're standing perpendicular to it, you can see that actually his fetlock's quite straight. And he's just a little bit of outward rotation, which can be, depending on its severity, can be normal in a foal of that age. And other considerations before recommendations come into play or treatment comes into play is, intervention. Is it necessary? Is the foal going to correct naturally anyway? If you do feel like intervention is necessary, when is the best time to intervene? And that brings us on to the growth plates. There are lots of numbers quoted in textbooks and papers for the time of these growth plates closing and the best time to affect them. But the upper growth plates, so the distal radial and distal tibial growth plates, will be active up until 2 years of age. But we're really looking to intervene with those animals at the kind of 10-month to yearly to 12-month-old stage. And then the fetlock growth plates close at 15 months of age, but again, really looking to affect those foals at that 3 to 4 month old age. And then how are we going to affect them? And that moves us on to treatment options. There are a range, obviously, of treatment options, both conservative and then surgical. So we'll go through a few of those options now. More conservative treatment options including stall rest and confinement, especially for these foals born with incomplete ossification of their hocks and their knees. They really need to be kept locked up and sometimes splintered until the bones have had a chance to fully ossify, and when that happens, then they can start a gradual return to normal management, but only when the x-rays are showing that the bones are fully ossified. Conservative would also include farriery, trimming, extensions, glue-on shoes, etc. There's a range of different things out there, but we'll just touch quickly on extensions. I prefer using extensions on younger foals, and so we're putting in this video here we're putting a little Equilox extension on the outside of a foal's foot, and this is going to increase the weight-bearing surface on that outside of the foot, which is going to allow more force to be driven through it, and as a result, it's going to slow that growth plate down a little bit, and so it's going to encourage the foal to push the toe out a bit more, and so this would be a common first-line treatment approach to a foal with varus fetlocks. I think you do have to be quite careful with young foals with the extremeness of the extension. It doesn't need to be too big or putting too much torque on those little feet. And then weight control. Again, weight control is usually, it's not a thing implemented in itself, just by itself, but in conjunction with other things, usually with extensions and sometimes restriction. Moving on to surgical treatment, there are two really major treatment options or treatment approaches, really, and then a third that I've mentioned at the bottom there that's really under very extreme circumstances. The osteotomy, ostectomy is usually reserved for those adult horses where there's no growth plate left to affect. So starting off with growth acceleration. Growth acceleration is the classic treatment for that is the periosteal transection and elevation, or a periosteal strip, and also shockwave is another growth accelerating technique. This picture is an extreme example of a periosteal strip. We wouldn't usually make an incision quite that size, but it gives you a good view of the technique being performed, and you can see the pieces of periosteum that have been split and elevated held in those forceps. So periosteal elevation, as we said, is a growth accelerating technique, so performed on the side of the leg that you want to grow faster. And you can see in the pictures here that it's usually performed just above the growth plate on the radius just above the knee, or in the tibia just above the hock, or the cannon bone just above the fetlock. This is similar to how I would perform this technique. Just a tiny little incision that you can then work underneath the skin to minimize the external damage or wound, and it means it heals a lot faster. So just gone in, a little inverse T incision performed underneath the skin, and then using a periosteal elevator to elevate that periosteum off the bone, the thinking behind which that's going to prevent the periosteum from restricting the growth of that bone on that side and allow it to speed up its growth. So a quick procedure and then bandaged, and generally those foals have minimal time in the box before going back to normal management. There is a bit of data on periosteal elevation, and we'll just go through a couple of papers here, and I will caveat that by saying that don't make too many judgments here until we get to a couple of slides from now. So this paper by Reed et al. Looking at 10 foals. So what they did here is they induced an angular limb deformity in the knee by placing a transvoicial bridge surgically. Then when they removed those implants, they then did periosteal elevations on the opposite side of the limbs, on one side, and then no surgery on the other side, and found that all of the legs were straight whether they were operated or not afterwards, or in all 10 foals. So again, results suggesting that really in these experimentally induced deformities, the periosteal strip wasn't particularly useful when compared with not doing anything. This is another more recent paper by Baker et al. Looking at 9 foals. These foals had naturally occurring bilateral carpal valgus, and so a periosteal limb was done on one of the limbs in all of these foals. And they found, when they followed these out, that all of the foals improved in angle, whether there was surgery done on the limb or not. So before making too many judgments, that's just what I said there. Before making too many judgments there, I want to emphasize that these are very small numbers. There's not been a lot of work done on this by any means. We're talking about one study with 10 foals and one study with 9 foals. And one of those studies, they induced the deformity in an unnatural form anyway. So I think it's difficult to replicate the natural situation. It's very difficult with a lot of thoroughbred things to introduce a proper control to that study. And so I think it has to be important. The opinion of those in the industry is very important. And if people feel like they work well, then that opinion is important and certainly shouldn't be ignored. I think there is definitely a place for periosteal elevation in foals, especially in carpal valgus foals. So moving on to more invasive surgical techniques. So this is the growth retardation, we refer to it as, or slowing down of one particular side of the growth plate. And there are a few different techniques that have been developed over the years. Starting with the picture on the X-ray on the left, there is a transvoicial staple, which is a bridge of that physis. It doesn't actually go into the physis itself. It's just a stapling across the physis to try and slow it down. This is generally reserved for quite young foals, and I think there are probably less and less of these being performed every year. The middle picture there is the screw and wire. I'm sure everyone's had experiences with these and seen these. This is, I don't think quite anymore, but was a pretty commonly used technique at one point. And then the picture on the far right there is the picture of the transvoicial screw, which is become probably the most commonly used technique as far as growth retardation techniques is concerned. So the transvoicial screw, as we said, is become probably the method of choice. And why is that? It is a very effective technique. It's a very quick surgery, and it has a very decent cosmetic results when compared to screw and wires, especially. And the advantage of just a single implant is that they can be removed standing, so that the horse or the yearling or foal doesn't need to go through multiple anesthetic episodes to have this procedure performed. The transvoicial screw actually it was probably being performed an awful lot before it started to surface in the literature. The first paper actually came out, this Witter et al. Paper, and the group in Kentucky at Hagyard published
this technique used to affect the medial aspect of the distal tibial physis, so placing of a transvoicial screw in the hock. This is probably the least commonly used of the transvoicial screws, so interesting that that was published first. But then there was more work quickly following that from Kay et al. Looking at the single screw transvoicial screw technique for forelimb angular limb deviations in 2005. And then more recently as well, transvoicial screws were looked at again by Baker et al. And I think this is probably the most complete piece of work performed on this technique. And they looked at sales and racing performance of a group of horses that had transvoicial screws placed, and then their maternal siblings. They looked at them as yearlings at their sale price, as 2-year-olds in training, and each sales then, and then winners in their racing statistics. And what they found was that those that had transvoicial screws placed were no different than their maternal siblings in any of those aspects. And so I think that's a real positive for the technique, showing that those foals with those issues, with those deviations, can, with help from a simple procedure, then match the same standards as their siblings without those deviations. Transvoicial screws can be placed standing. This was another paper that was presented at EP. These I was actually involved in some of these cases when I was an intern, but these were performed standing in carapaces only, and they were performed in horses that could not undergo a general anesthetic procedure for a number of reasons. But it would not be anyone's preferred technique to perform them like this. The complication rate is certainly a little higher, but it can be performed. And then, so just moving on to really the most important thing of the procedure for me, this is really what it starts with, and I think this is probably the hardest part of all of it, is the evaluation. Starting off, as we mentioned, looking at them sort of 4 to 6 weeks of age is usually when they get flagged up on the farms as being a little deviated or deformed. And so I like to follow them out to at least 6 or 8 weeks. This foal on the left has had a Varus deviation of both front fetlocks since just a couple of weeks of age. And we looked at it at 6 weeks and recommended a few farriery changes or just some extensions. And then looking at again with the extensions off at 8 weeks, it's improved a tiny bit, but it's not where we need it to be. And so this is going to have recommended to have surgery. And so moving on to the surgery, the procedure, this is just a little video of how we set up the foals. But this is a bilateral 4-limb lateral fetlock transvoicial screws placing. So just a picture of the setup and the prepping of the foals, obviously under general anesthetic. And then quickly into the procedure. So once they're all set up, they get draped for surgery, and we take a pre-surgery x-ray just to locate growth plates and make sure we're in the right, happy with the positioning. And then a single 3-2 drill tract is drilled for then placement of the screw that starts off above the growth plate, through the growth plate, and then into below the growth plate. And just see us drilling the tract here, just checking the depth. Usually use a pretty similar length screw every time, but we do check the depth of the hole just to be sure. Happy with the drill tract, and then the screw is placed within that drill tract after we check the depth. And then we once we're happy with everything, we take a post-op x-ray to make sure we're happy with the positioning of the screw before closing the skin. And then post-operatively, they get managed in a light bandage for 2 weeks and stall rest for 2 weeks as well. Bandage changes when needed. And then come 2 weeks, the bandages are taken off. I usually like to have a look at them at that point, make sure we're happy with the surgery sites. And then serial evaluation again begins on the other side. So now we're looking at them to see when we want to take the screws out. This is a kind of a walkthrough case. This is a yearling that we looked at with a few different issues, but obviously at a yearling stage, he's too old to be affecting the fetlocks. So he had quite a Varus
left knee, and we placed the transvoicial screw, and now we can see in the video here on this video playing that the deviation is corrected. We're happy with the overall conformation of the yearling now, of its knees anyway. And so we decided to take the screw out. And this can be done at the farm just under some mild sedation and a little bit of local anesthetic. So this is actually, obviously it's not the same yearling because we're doing the right leg, but this is one of its friends there that also had a similar thing done to the right leg. So the screw is just taken out through a little stab incision. As I said, sterile prep and everything as normal. And they tolerate this remarkably well, and has the advantage of being at the farm, not having to stress the animals out, bringing them into the hospital and trailering them. And generally tolerate it much better when they're in their own environment. And this is a similar procedure being performed on a foal. This foal had a bilateral Fetlock Varus actually, and this is it's having its right front fetlock screw removed. The left front fetlock screw on this foal is still there, that is still in place. The deviation is not quite ready on that one. So we'll come back a week after and review it and see if it needs to come out then. And taking them out individually allows you to make sure you get an ideal conformation in both legs. Again, with the foals especially, I think they tolerate this much better at the farm in their own environment. Again, mild sedation, a little bit of local anesthesia, a little stab incision, and the screw can be removed. Now for some of the more complicated cases, so hind limbs, generally we would put those under a short-acting GA, obviously in the hospital so that we can use all of the monitoring equipment and have the expertise present. But they're put under a very short-acting GA. They're not put on any anesthetic gas, just oxygen, and that gives you 10 minutes, enough surgical time to remove the screw in the outside of a foal's fetlock. The same would happen with any inside of the leg screws, whether those would be knees or fetlocks, and the same for hocks. Complications with the surgery, as with everything, it's not 100% unfortunately. There would be, the most common would probably be infection. And these can range from little suture tract infections, which generally resolve with no problem, to more complicated infections involving the screw itself. Generally, removing the screw or the implant at that point will solve that problem. And then probably the most severe complication is the broken screw. So you can see in this picture here, the screw head has snapped off the shaft of the screw in this knee screw, and it requires some specialist equipment and a general anesthetic to remove that piece of implant. It is completely removable, and those horses go on to be fine afterwards. It just has to have a bit more of a major procedure to remove it than just a standing screw out. These things usually break when they're being taken out. And then probably the most rare of the complications would be overcorrection. I think some of this has to do with when the screws are put in. I generally like to put them into foals where the risk of overcorrection is very low because we're nearing the end of the growth phase anyway. But this foal has had a medial screw placed in its knee, and now you can see it's got a medial deviation from the knee down, and it's going to need a lateral screw placing to correct that. So I just wanted to take the rest of the time there, just go through a few case examples, and obviously if there's any questions, work away there. So this is an 11-week-old foal. So as I said before, usually you would be looking to act on these foals surgically anyway. At that 8 week of age mark is really the best time to start thinking about doing things with them. This is 11 weeks old, and so we've had a conversation with the owner about whether there's enough time left in the growth of that fetlock to achieve what we want to achieve. He's got a decent enough bilateral Fetlock Varus worse on the left. And so the conversation goes along the lines something like, well, we feel like we've only got to move the right fetlock a little bit, so plenty of time for that, but the left we might improve, but we might not get it all the way there just from a time limit. Actually, this foal, I've taken both of this foal screws out now, and we did achieve a very nice result in both fetlocks. This is an 8-week-old foal, so more the right age for acting with a left front fetlock varus. See as he comes back to us here. This is probably the most classic case of the examples we'll go through, and these tend to be much easier to judge on the back end, as in when to take out, because they've already got a very nice leg to aim towards. So this is the Fetlock Varus. He's had extensions and things have improved a little bit, but it's not quite where we need it to be. So this foal had surgery, and again, this foal's had its screws out, and it looks very good now. Right, move it on now. This is a different kind of a case. This foal was windswept since birth. It's now 8 weeks old, and a couple of issues with the foal. It's got a pretty rotated and valgus right front, so it rotated from the knee down, and then a bit of a fetlock valgus. But what's more concerning is the left front, which is very straight through the knee, almost starting to try and push that knee outwards a little bit, and then he's got a left front fetlock varus, which is probably the most concerning of his issues. So this foal at 8 weeks of age had surgery in the left front fetlock. A screw was placed, and by the time the screw was removed, a few weeks later, we had a nice conformation in the left front, as well as derotation and correction of the right front just from natural correction. I put this one in. This is a case example of a hind leg. Now, hind legs can be a bit controversial whether to act on them or not. My own opinion is that I think when they are quite severe to the extent that you're worried about supporting the hock above it, and you're having to use quite extensive farriery options on the foal's feet, I think that they are candidates for doing this procedure. The procedure works very well on hind legs, and I think with the more extreme examples, this one's got a pretty extreme left hind fetlock varus and has had all sorts of farriery to try and support the leg. And this foal's actually had its screw out already. I think it was in for 3 weeks, and now it's got a nice straight fetlock, and it can be managed as a normal foal with normal farriery. This is a kind of harks back to the slide I had up before through the diagnosis portion of the talk. So this foal, when you're looking at it head on, looks very valgus through its fetlocks. But when you actually take a step, hopefully this works, yeah, when you take a step to the foal's side and line up that cannon bone like we were talking about, which we do here, now we can see that actually his fetlock's quite straight, but he does have a bit of a carpal valgus. So now we're looking at a different problem. And so this foal had bilateral carpal strips and has improved in conformation since. So I think that's just quite a good example of taking that step to the side and lining up, getting yourself perpendicular to the foal's leg or to the deviation part. Moving on to a yearling here. This is an 11-month-old yearling with a left front carpal valgus. It's suffered from being a little rotated through that left fore since it was a foal. And we did nothing with this yearling and just let nature take its course, and was reviewed 3 months later with not fully but some resolution of the problem, and I should imagine that yearling will go on to be fine as it puts on a bit of weight. It's still quite base narrow in this video. It's quite a thin chest, so it's got quite a lot of development to go, and as it broadens out, it will derotate in that leg. So this is a 12-month-old. So we were looking at this horse since it was 8 months old, I think, just after Christmas, and just trying to manage it along until it was at that year-old stage. When we first looked at the yearling, it had already the right front fetlock varus was obviously an issue that we can't do anything about at this stage, but we can try and help the knee conformation above it. These are often the most difficult cases. And I go back to saying that if you can get the fetlocks on them right, then you've far less problems with the knees when they're a bit older. So it's obviously got a varus fetlock, as we talked about, and it's got quite a carpal valgus, varus knee above it. So sorry, that's a typo in my presentation there. So this yearling had a screw placed on the outside of its right front knee. And then this yearling again has a bit of a left front carpal varus, and this is the video before surgery. And then this is the video, I think this is the video when we took out the screw. So we're much happier with that yearling's conformation through that knee now. Tracks a lot better. He's got a much nicer, straighter knee. So we're very happy with the result here. Much improved. So that's all I have for you. Thank you very much for putting up with it, and I'm happy to take any questions.
Matt, thank you very much. It's Celia Marr here. That was a wonderful presentation, and in particular, your videos were fantastic. I'm going to hand over to James Crowhurst, who has some questions and comments for you.
Perfect. Thanks, Celia.
Thank you, Celia, and thank you very much, Matt, for comprehensive overview of angular limb deformities. We've got a very experienced panel here. Some might say a bit Newmarket centric, but I think there's going to be some good discussion and comments on all this. I'd like to start it off by saying that obviously we made huge progress over the period of my working life, and things have moved on, and we understand a lot better about the effect of these conformation on racing and all that sort of thing. And I would certainly agree about one of the issues that perhaps has not improved in some ways is that we're dealing with quite a lot of heavier foals now than we used to. And we are all seeing a number of foals that are too heavy really for their limbs. And it's another good reason for regular weighing of foals during their growing up period and yearlings to reinforce one's impressions by looking at them. And we in our practice, we've really given up on periosteal strips ever since David Ellis, one of our retired partners now, he did his Royal College Fellowship on Angular Limb Deformities, and was called into one foal that had a periosteal strip done on the wrong side, but still got straight. And we also met a vet who not in Newmarket who was doing the stapling of foals at the carpus, but always said that he left the staples in and never ever took them out without seemingly a detriment, which startled us somewhat. But he said, "Oh, I never take them out." But so we would not really do any periosteal strips now. And I think Matt Smith, one of our surgeons at NEH, he reports about a 1.5% surgery rate amongst the population of our foals, and the ones we referred to are keeping it quite low. But I know that levels of intervention have risen quite a lot recently, and I'm very interested to hear what the rest of the panel say. Things have moved on, particularly with farriery and what we can do to foals' feet. One thing I would certainly agree with as well is that the Mother Nature is terrific at sorting many of these out. And when I was younger, we were always told we had to intervene much earlier if we were going to do surgical correction. And now we realize that there is some residual growth rate much later in life. So we would perhaps be a bit conservative in hoping that foals might straighten themselves out a lot, and knowing that we still have a little bit of time to do something, even as yearlings, as you've said. It does startle me how much some of them can correct themselves to a satisfactory degree. I'm going to pass over to Fred and hear his comments.
Thank you very much, James. Matt, thanks very much for an excellent presentation. I was I agree with James in many ways that periosteal strips are no longer, they never really were in fashion in Newmarket. We certainly are doing far fewer than we ever did. But I think what was interesting is you are accentuating the issue of the varus conformation. In other words, the towing in conformation, or the deviation towards the midline of the animal, as being a far greater issue than what many people can consider, or what many people often think is the opposite is an issue. In other words, the valgus, the towing out, the outwardly offset limb. And I think probably by highlighting that, you're highlighting the inherited conformational defect or problem that is possibly the most likely to cause or have a detrimental effect during athletic performance. And I just wondered if that is the case or not. Is the towing out, the valgus conformation, less of an issue than the varus conformation?
Hi, Fred. Thanks. Yeah, I would agree with everything you just said there, and I would operate on very, very few valgus fetlocks for sure. I think the people that taught me, I was trained in America, and the people that taught me would tell you that, and I'm sure you guys have seen the same here, that 30, 40 years ago, we were looking at a lot of foals that were valgus and a lot of older horses that were valgus, and that's somewhat changed, probably because of breeding and other reasons as well, to these days having a much bigger issue, as you mentioned, with Varus fetlocks. A Varus fetlock in a foal that's very straight to medially deviated is not going to improve by itself as the foal grows, and so you do have a window of opportunity to affect those animals, as they are not going to naturally improve, unfortunately. So, and then if you do have a foal that is got a varus conformation that grows to that weanling stage past when you can affect its fetlock, then a lot of those foals will then start to push the knee and get a varus conformation in the knee, which we know goes on to then cause issues with horses in training. So, I would definitely agree that the varus conformation is definitely more of an issue, and unfortunately not one that improves by itself.
Matt, can I just pick up on one of the points that James made about weight control, which is probably slightly more my area, but I wondered if Chris would comment on that, because it seems to me, you can weigh the foals and establish that they're growing too quickly, they're getting too heavy, but what can you do to slow them down, particularly in that very young age group where essentially their main diet is the milk that the mother is providing them?
Yeah.
Yes, Matt, thank you very much for your talk this morning. As always, very interesting. And Celia, yes, it is a very important factor, the fact that we have inherited a problem really with foals becoming too heavy. We probably have the mares too heavy as well, which allows the production of milk and the richness of the feed that we're giving them, and the ample grazing gives them that opportunity to gain in weight and add on the calories. But I think from the actual management point of view, from on the farm, you can never start looking at your foals conformationally too early. And I think a lot of people perhaps get, especially perhaps on larger farms, you don't necessarily walk them up and down and do as much inspection, whether it's in the paddock or on the hard. I think it's equally as important. And at that same time, you can then look at your foal and evaluate its weight along with its conformation. I'm a great believer in that the picture that we're all trying to put together is a part of is a puzzle really, and we're trying to put all the pieces of the puzzle together to get the complete picture. And you probably never quite get the complete picture, but you keep working away to try and find the solution. And I think your staff are so important, and they notice something that's not quite right, they'll bring it to your attention. And an owner similarly, if you've got a small place, you've got your few mares and foals at home, it's important to watch them move and to watch them from both the front and the back, because that gives you the angles. And I suppose you mentioned you were trained in America, and I suppose in a sort of way I started off, spent quite a lot of time in America, and was first introduced to this procedure for the periosteal elevation by the late Paul Thorpe at Hagyard, Davison, McGee, and I was rather taken with the procedure, I have to admit, and I have continued to evaluate the foals that I'm in charge of or look after with my team, and we are probably a higher user of this procedure. And this year with 67 foals, I have put a screw, or you have put a screw in a foal to stop it from towing in, to improve it, and it's made a huge difference, and the foal is now back out with its group and conformationally correct. I have also, I suppose, done or had done a number of periosteal elevations on a few other foals. And I think a lot of it is, once again, looking at your mares. Now, you may have a terrific race mare who's not very conformationally correct, which happens, or you may have a mare that is extremely well bred that didn't race because of some sort of conformation. But if that mare produces as a similar conformation that she has, you can, it's sort of almost generic. It's also a genetic sort of situation is developing. So I think, as I say, we are so wonderfully fortunate in this industry to have modern technology advancing at such rates, and CT scans, MRI scans, bone scans, all those sort of wonderful things that we have available to us for horses in training allows us to be able to monitor the stress that horses endure once in training. And I think if we can continue to encourage active, visible inspections of young stock, it does play a huge, important part. And taking photographs, videos of your foals, as yearlings, I think also gives you not only a good library of information for your own use, but also gives gives you a great understanding of how those limb changes are affected by time. So it's it is a very very important part of what we're doing. So I think one question that obviously that I would maybe put to you is, and not in any great detail, but we do have a number of I suppose the horses that are asked to perform earlier in the very very commercial market that we are now in. A lot of racehorses are sort of are pushed earlier at 2, and the stallions. Some stallions, are top class 2-year-old racehorses, and therefore are much more stockily built, much more heavily muscled, and you suddenly got a lot of pressure being put on the younger stock because of the commercial aspect. So when one's looking at those, those particular horses or young stock that's bred by those stallions, it's important to assess them. But I think it's an economical situation as well. I mean, people have got to look at the costs of such procedures as well, and weigh up the importance of that. And I think we certainly want to encourage people to keep looking. As I say, it's probably a procedure that is very important and needs to be to be followed to the highest level.
Matt, did you want to comment on any of?
Yeah, no, I would absolutely agree with Chris. I think that, as I kind of touched on in the presentation, I think really the people that get to see these animals progress the best are the people managing them at home on the farm. So, the vets, I think, perhaps to a less, for sure in my case anyway, to a lesser extent, I would look at a foal and maybe I'd see it again as a yearling, but being able to look at a large group of foals progress, knowing the stock that they come from, knowing the stallion that they came from, and how his genetics work as well, is all part of the picture. And in a way, the surgery part of it, of putting the screw in, is really the most simple aspect of the entire thing. The constant management of these animals is absolutely key. And from our point of view, as vets' point of view, having a good relationship with the farm manager is incredibly important when it comes to that. So it's definitely, as Chris says, it's a team approach, a team effort, and to try and get the best result possible.
Matt, well done. That was an excellent presentation. I'd just like to make one or two points. You brought up the American papers on the performance of horses that have had screws placed in them as being equal to their correct siblings. It would be very nice to repeat this sort of research in Europe, and I think we should make every effort to follow the animals that we operate on to make sure that in correcting their conformation, I'd like to think we're improving their racing performance, but certainly not detracting from their performance. We, as you obviously know from our work together, have become much more proactive in dealing with the Varus deformities that you have described. And I just wanted to say that in correcting those fetlocks at the 2 months to 10-week stage, the response does seem to be excellent. Earlier on, we've been using extensions, and extensions when the ground's soft are fine, but managing foals with extensions on, which you didn't really touch on, can be quite difficult, and particularly if we have hard ground, fractured pedal bone wings can become quite an issue. And if you are faced with a situation of using extensions or screws, if the conditions don't favour extensions, I am rather more in favour of screws now, rather than having to shut the mare up to deal with a fractured pedal bone. And just on the point of fasciitis that you brought up, fasciitis is considerably less of a problem than it was when I started in practice in Newmarket, and that is clearly dietary and improvement in the balance of the ingredients of the feed, and it is really important that we spot the foals with fasciitis before they become severely inflamed. It is a failure of endochondral ossification before it becomes a severe inflammatory change. You rather implied it was purely inflammation. I don't think that quite is the case. It's the failure of endochondral ossification that produces the inflammation. Those are the points I make. I'd just like you to comment on those if you could.
Yeah, no, I would agree with everything you said, Nick. I spent most of, as I kind of touched on before, I was trained in a different climate, I guess. I think that's quite important. I think I certainly speak to my colleagues around the world that would do similar work to me with young breeding stock, and those of us that are in this part of the world certainly face different issues here in Ireland and France versus those people that are working in Kentucky or in California or Australia. And that has to be down to climate changes, as well as perhaps genetic stock from the different breeding stock in the different countries. But I think as things become international, that's kind of leveling out a little bit. I would certainly agree with your comments on fasciitis. It is important to spot them early, because oftentimes I would be presented with a foal that's got quite a bad fasciitis. and you're really having they come on very quickly, and those foals that looked normal a week ago often are starting to look pretty bad in a short period of time, with a window of opportunity to affect that growth plate closing. And so you really want to try and avoid having the situation where you're talking to the client or to the owner about damage limitation rather than getting the foal correct. So as you said, yeah, quickly, and just echoing what Chris said before, constant management and constant reviewing of the animals is very important.
Thanks, Matt. It's James again. I'd like to reiterate Nick's comments, certainly about extensions and hard ground. There's some extensions go on with a little step underneath the foot, and there have been too many pedal bone fractures with those. And I now encourage studs to, if they possibly can, and have a borehole to irrigate nursery paddocks, because one thing that we have learned over recent years, which we suspected earlier on, but we now know, is that any form of shutting up of young horses is bad for their skeleton and musculature. And one of the big advances in my lifetime has been the gradual move with climate change to get mares and foals and young foals living out, which I think the more exercise they have is better. And we always hate to shut them up for any reason. So Celia's question about what can we do if they're overweight is we don't want to shut them up, and we don't want to restrict their exercise if we possibly can. So it's a question of trying to correct the diet, if they're creep fed, or the mother's diet, and that sort of thing. Anything to not restrict their exercise, or worse, box rest. So it is an issue, and we've got to really be on the lookout for that.
Yeah, I would certainly agree. I probably find the most challenging of the cases is the yearling, the 8-month-old to be yearling that's a little heavy set and starting to push its knee. Is the management of that animal. I think operating that animal at that age is too early. I think you risk getting the knee correct, taking the screw out, and then allowing there still being time for that knee to deviate once more. And so definitely like to try and get those animals 2-3 months older before intervening if necessary. And so that conservative management and management of the animal's nutrition, farriery, etc. at that age is definitely one of the most challenging parts of getting those yearlings correct. So yeah, I would agree with everything you're saying.
Matt, it's Fred here again. Just to throw in maybe a small grenade into the discussion. We all agree that and understand that conformational traits have a high heritability. So we're going from one generation to the next. We're doing fantastic job for the individual animal at a generational level by monitoring it, optimizing its nutrition, providing, assessing it, providing surgical help to correct conformation. Are we doing the breed any good in the long term by intervening at these levels and correcting these foals? And are we not perpetuating inherent conformational defects that potentially we all fear have got a detrimental effect if they're not corrected?
Yeah, I think you make a good point. I think that there's definitely a cohort of those animals that are purely genetically varus that we're affecting to make them conformationally sounder. But there are also, I think that's only a proportion of the ones that we're looking at. I think those foals that come out windswept with a normal looking mare from a normal looking stallion are probably a different cohort. And those ones that acquire the deviation due to fasciitis or to a traumatic event for another reason are another cohort. So I would counter it slightly by saying it's not all of them that are purely genetic. And probably the other point, and I kind of touched on it briefly, is that, and I'm certainly don't have the experience to back this up, but the people that taught me would happily tell you that, you know, that the breed has dramatically changed over the last 30, 40 years. And what's to say, I guess, that it won't change back or change for another way in the next 30, 40 years. So I think from my point, trying to help the individual is enough for me to deal with at the minute.
Thanks, Matt. It's James again. I would agree with Fred's question. And as racing and animal welfare comes under increasing scrutiny, and I'm spending quite a lot of time, my TBA time now, on these committees, I think we may come to a stage where we have to justify entirely what we're doing, and we need to keep a critical eye on all that. Just as one comment I would like to make, and it's not for today, is that in all my lifetime, we don't seem to have made much progress with acquired contracture. And it was one of the things that I was hoping that we would make good progress during my lifetime. And I know it's a very expensive and difficult thing to investigate properly, but I don't think the incident rate has dropped significantly, unlike many of the other things that have dropped, including foal diseases and all sorts of other things during my lifetime. And it's a good subject for another debate. I don't know, but we could be here all day with that.
Yeah, I think James will have to say that will be next year's Gerald Lee, perhaps, or maybe the year after. I'm going to draw things to a close now and thank everyone who has contributed to the discussion, and in particular to thank you, Matt, for a very thought-provoking presentation. Thank you very much.
Thanks, everyone. Thanks, Celia.